Here to explain what we can expect during labor and delivery, Dr. Kristin Brigger, an OB-GYN on staff at the Women's Hospital of Texas. Welcome to the show, Doctor. It's great to see you. And let's just chat about the Women's Hospital of Texas, because last year, I understand you delivered more than, well, not you personally, but the hospital, 11,000 babies. So you know a thing or two about delivering babies, huh?
I personally didn't deliver all 11,000. We have an amazing staff at our hospital that we all achieved that together as a team. But it's a very great specialty hospital where they provide state-of-the-art care for mothers, newborns, and babies. Children as well.
Well, you know, thank you so much for being here and spotlighting this incredible topic, because we had a colleague on staff who just had a baby. I have several friends who are pregnant right now. And I think the big thing for expected moms is the concern is whether or not it's safe to go to a hospital to give birth.
Right. And, you know, I've even had patients of mine ask me about home births and things like that. But we know that the safest place to have a baby is within a hospital setting. And the Women's Hospital of Texas has definitely taken amazing steps to ensure that all of our patients and staff are safe during the delivery process. They have kind of the most forefront process and screening and making sure that everybody that comes into the hospital is not going to put anybody at risk.
And also, let's just break down sort of the symptoms and the testing procedures you have in place at the hospital, because I know for a lot of folks, clearly, if you are expecting a baby, you want everything to go very, very well. Some people might be nervous that, oh my gosh, I have this cough. Is that allergies? Is it COVID? So break down the symptoms and your testing protocol when someone is coming in about to give birth.
Right. So everyone that comes into the hospital gets screening questions for the symptoms of COVID, such as fever, chills, body aches, headache, sore throat, and also lack of taste and smell. We screen everybody in entry by taking their temperature. And then we also have screening procedures in place for our mothers. So everyone that has a scheduled delivery, whether that be a scheduled C-section or a scheduled induction, comes to the hospital about 2 days in advance of their scheduled procedure, and they get swabbed for coronavirus. And so we know even before they come into the hospital whether or not they are positive or negative. And then for moms who come in active labor, because these babies just kind of come whenever they want, we have rapid screening available as well. So for the moms that test negative for coronavirus, we put them in what we call the green zone of the hospital so that we keep the healthy patients together. And then for patients who test positive for coronavirus, we have what we call the orange zone, which is kind of our quarantine zone, where we can keep those moms together. And we also have our staff be able to use the appropriate personal protective equipment to keep them safe and keep the moms and babies safe as well.
And obviously, this is a new virus. We're learning things about this every single day as this continues, of course, on the research side of it. But if the mom is COVID-19 positive, is there any research or is there any information that would suggest that then the newborn baby would then be infected?
Right. So, you know, as you said, this is kind of an evolving disease, but there's been no evidence at this point that has been shown that coronavirus passes to the infant in utero. We definitely know that after delivery, there can be transmission to mom and baby, but as far as having the infection pass to the baby while mommy's still pregnant, there's no evidence to support that at all.
And let's talk about the birth experience. So let's say in the event that someone tests positive for COVID-19, a mother expecting, how would that birth process or birthing process be different? And also, once the baby is born, what are the steps that the hospital has in place to ensure that the baby is kept safe?
Right. So during the birth, we kind of quarantine the patient and their support person into that labor and delivery room, so that we try to minimize the amount of times that patients and the husbands kind of go in and out of the room. So they kind of stay in that room and the nurses go in and out. At delivery, the mom will wear the protective equipment as well as a support person and all of the staff, as well as the delivering physician, to just help minimize the spread from the patient to her loved one and also to the medical staff involved. We do have the NICU team available to take baby immediately after delivery, which is kind of the hard part. But so far in our hospital, no babies have become positive from moms that were born that were positive for coronavirus. And we test all babies after delivery, about 24 hours after birth, to make sure that they are negative.
And you know what, I think a lot of people, I think one of the concerns, especially one of my friends who's pregnant right now, first baby, is will my husband be able to be in the delivery room? And I know this is probably case by case, but let's just say both negative and no symptoms whatsoever. This has really changed the birthing process, whether you are negative or positive for this, right?
Correct, but at the Women's Hospital of Texas, we definitely know how valuable that support person is to our moms, and we want to encourage that bond and that support that that person brings to our delivering mom. But we also have to balance the risk of bringing excessive patient, visitors into the hospital that could potentially bring the virus in. So right now we have one support person that we encourage patients to bring with them to the hospital. And those support people are allowed to stay with the patient the entire stay. We also have iPads throughout the hospital that the patients can use to talk with their family members, because we know that, that one support person is not the only people we want to share this joyous occasion with. We have lots of family members and friends that like to celebrate these new additions. And so we do have virtual ways that we can celebrate these babies with our loved ones. And so we do have those technologies available at the hospital. So it's really nice. And, I've had a lot of patients be a little bit disappointed about not having to have their whole family there, but after the experience, they do say how amazing it is to have just that intimate moment with just their partner and their baby. Mm-hmm. So I have had patients be surprised at really enjoying that intimate moment, versus the normal thing that we anticipate of having that big group of friends at the hospital with us.
And Dr. Brigger, we've got less than 30 seconds left, but very quickly, two more questions. If mom is scheduled to have an elective induction to be induced, right, but she's also COVID-19, can she still proceed with that appointment? And lastly, what about breastfeeding? Very quickly.
Yeah, so we keep those inductions scheduled as normal, so that way we can kind of have time to prepare for those patients. We'd rather not have them come in kind of in active labor. And then with breastfeeding, especially if you're COVID-19 positive, we really want to encourage hand hygiene as well as masking of the mom during breastfeeding. So we do encourage breastfeeding even if you're COVID-19 positive. You just have to be very meticulous about hand washing and masking during that process.
All right, Dr. Kristin Brigger, thank you so much for your time today and for the info. Hopefully, we help put a lot of moms' minds at ease and their families as well. And for more information about the Women's Hospital of Texas, you can visit their website, womenshospital.com.
Thank you, guys.
Thanks so much.